Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at the Virginia Center for Plastic Surgery in Alexandria, Virginia, discussing Vaser liposelection and how it can help you achieve the shape you've always desired by eliminating unsightly fat and cellulite with one of this area's top plastic surgeons, Dr. Eric Desman. Dr. Desman is board certified by the American Board of Plastic Surgery, is a graduate of Duke University, and received his medical degree from Jefferson Medical College of Thomas Jefferson University in Philadelphia, PA. He is a member of the American Society of Plastic Surgeons, the Virginia Society of Plastic Surgeons, and the Medical Society of Virginia. Welcome back again, Dr. Desman.
Thank you.
It's our pleasure to have you on. We've got a lot to talk about regarding another very popular procedure that's very precise as far as eliminating fat and cellulite from difficult areas that traditional cosmetic procedures haven't been as successful and precise with, and that's liposelection by Vaser. And I wanted to begin by having you tell us what exactly this is.
Well, Vaser liposelection is a technique that's used for body contouring. Traditional liposuction is done by using what's called a cannula, or a small hollow tube, and manually removing the fat tissues. And in doing this, it's not very selective, and blood vessels and nerves potentially can be damaged with traditional liposuction. With Vaser liposelection, the way the procedure is performed is first some fluid is put into the tissues that we're going to work on, and this fluid contains adrenaline. And the adrenaline causes the blood vessels to shrink down. Then an ultrasonic probe is placed into the fatty area, and the ultrasonic probe basically vibrates at thousands of cycles per second and causes the fat cells to be emulsified, or just disrupt, and it essentially dissolves the fat cells. After the ultrasonic probe is removed, we then take a hollow cannula and gently remove the dissolved fat cells from the tissues. This is much gentler, much more selective. The ultrasound probe is tuned just to dissolve fat cells. So the ultrasound probe doesn't harm blood vessels, it doesn't harm nerves, it doesn't harm muscles. And that's why it's called liposelection. It really selects out the fat tissues and allows us to treat in a much more precise fashion the fatty areas that need to be contoured.
So based on what you just described, doctor, as you just said yourself, unlike traditional liposuction, liposelection by Vaser, this particular technique in body contouring gets into that precise, targeted area within one's body where we want to eliminate the fat and the cellulite from difficult areas, so to speak.
That's correct. And because it's so selective, we're able to treat areas of the body that we were not able to do as well with traditional liposuction.
And what areas of the body can be treated from this?
Well, we can pretty much treat from head to toe practically with the Vaser liposelection. Areas underneath the chin and in the neck area are much better treated with Vaser liposelection, for example, than traditional liposuction. Underneath the arms is another area where patients get a much better response from Vaser liposelection. A lot of women come in and have some problems with areas on their back near their bra strap, and Vaser liposelection works wonderfully in this area to help change the contours and improve the area.
You certainly mentioned some difficult to get areas.
That's correct.
And what type of results are we looking at from liposelection?
Well, patients see results almost immediately. There is usually a little bit of swelling right after surgery, and once this goes down, they're able to see the change in their contours quite quickly. The results are very nice because it is so selective. There's generally less bruising and less pain and discomfort associated with the procedure. Now, with any body contouring procedure, traditional liposuction or Vaser liposelection, part of the results depend upon the patient's skin tone and elasticity. And so while there is an immediate change in the contour of the skin, It takes several months for that skin to ultimately tighten up to achieve the maximal result that they will see. So they'll see a result right after the swelling goes down from surgery, and then over time that result will continue to improve over the course of several months. And that's whether you're using Vaser liposelection or traditional liposuction.
Oh, that's certainly very good for us to know. And as far as the fat that's being removed, are we looking at quite a bit?
Well, depending upon the areas that are treated, we can take out up to 5 liters of fat at one time in a safe fashion with patients, and this can cause dramatic changes in the body contouring.
Oh, so that is fairly significant as well.
Yes.
And where is this procedure performed? Is it something that can be done? Is it a hospital setting that's required, or?
This is usually done in an outpatient operating room.
Is there any anesthesia that's required as well?
Generally, the fluid that we put in to shrink the blood vessels with the adrenaline in it also has some Novocaine in it. So the procedure can be done just under straight local anesthesia, or under IV sedation, or under general anesthesia, and a lot of that has to do with the patient's preference.
What would you say is the anticipated recovery time? I know it varies, I'm sure, patient to patient, but typically what are we looking at?
Typically we're looking at 5 to 7 days in recovery at maximum for kind of returning to normal activities and feeling well. Many patients who have limited areas done, like under the chin or the neck area, are back to kind of normal activities within a couple of days.
Now, we've only got a few moments left, Dr. Desman. I wanted to ask you, before I let you go, if you have any final thoughts that you'd like to share with our viewers.
Patients have a wonderful experience when we use Vaser liposelection because of the quick recovery and the precision that we're allowed to have with the technology to get a great result in their body contouring.
And on that note, I'd like to thank you for joining us again and being a guest on A New Me.
Thanks, Rocco.
It was our pleasure.